clock is saying 2 o'clock, so let's go ahead and get started. And I will call the meeting to order. Do you need to call the roll? Go ahead and call the roll.
Lynn Whitley, County Judge.
Here.
Lord Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Charlie?
Thank you, Judge. I'd like likewise call the meeting from the Tarrant County Hospital District Board of Managers. We'll call it for the same joint meeting. I think we are all 11 are here. 1, 2, 3, 4, 5. No, we're missing one. Everyone's here except Reverend Emerson at the current time and Roger Fisher. So 9 of our 11 are here.
Okay. I guess we'll go around, and let's go around and do introductions, just because there's probably some folks in the room who may not know some folks at the table. So go ahead and let's start us off.
Hi. Good morning. I'm Amanda Risola. I am representative on JPS board for Precinct 2.
Hi, I'm Dorothy DeBose, representative of Commissioner Brooks.
Trent Petty, representing Commissioner Fickus.
Steve Montgomery, County Judge Glenn Whitley.
I'm Robert Early, President and CEO at JPS Health Network.
I'm G.K. Manius. I'm with Tarrant County.
J.D. Johnson, County Commissioner.
Devin Allen, County Commissioner, Precinct 2.
Roy Charles Brooks, County Commissioner, Precinct 1.
Glenn Whitley, County Judge.
Gary Fickus, Commissioner, Precinct 3.
Stephen Simmons,
Zim Zimmerman, representing J.D. Johnson.
D.T. Moon, representing Commissioner Allen.
Charlie Powell, representing Judge Whitley, and also have the pleasure and the privilege to be the chairman of this organization for the last 3 years.
Chuck Weber, representing J.D. Johnson.
Mr. Manius.
Okay, thank each and every one of you. Just some ground rules. We have mics in front of everyone. We're going to make sure that whenever you speak into the mic, because we are recording this. What we thought we would do, first of all, understand that this is a work session, and that means that while staff will do some presentations, the key to the success of this work session is that we get the court and the board to enter into some really good discussions and conversations about not only the bond package, but how we move forward in that bond package. And so we are going to go ahead and give you some information that we've put together, and it's going to be somewhat of a tag team match, but it's going to be, once that happens, we're going to pretty much open this up, and we'll help lead through the discussion of the agenda that I gave everyone. I believe that you've already seen that at least once before. So if we could do that, then we're going to go to item number 3, which is a brief review of the Blue Ribbon Committee recommendations. That's Trent Petty. Trent was a member of the Hospital District Board of Managers, a representative on that particular committee, and he's also chair of the Planning Committee. So, Trent, if we can ask you to take over.
Certainly, thank you. Appreciate it. It's an honor to be here today, and it's an honor to represent the board on the Planning Committee. Most of you know Dr. Simmons and I were on the Blue Ribbon Committee, as well as Dr. Lowry, and I think many of you know DT attended many of those meetings as well. I would just summarize the Blue Ribbon Committee in a manner that says there were several themes that emerged in that process that I think really rang true with all of us. And those were population health, primary care access, behavioral health clinics, transformation of healthcare in Tarrant County, partnerships that needed to emerge, and overwhelming volume that we needed to work with. Those facets sort of drove the entire Blue Ribbon Committee process. And they have continued to drive the process from the Planning Committee and the board as it relates to where we are today. Some of us have been here for over 10 years and began working on this project literally a decade ago and began looking at the campus and the need of JPS and all of our clinics and where we need to go and how we get there. So it has been a long labor of love to get here today. We appreciate very much the commissioner's support for the work that we have done to this end, and we are here to serve you. We now want to make this process work. We want to be able to leave here today with a plan to help us execute the policy decisions of the Commissioners Court in a manner that you see fit. And I think every single one of us are happy to do that and looking forward to doing that and want to move forward. So, GK, do you want me to start walking through the slides here?
Please.
All right. And I am not going to read these, and I'll promise not to take much of your time. You all know most of this we have already begun. These are the Blue Ribbon Committee recommendations. The Cancer Center, you know the work that we have already done to that end. We have significant savings with the decisions that have made to date regarding the Cancer Center, which will ultimately reduce some of our capital costs that would have been against the bond campaign. So that's been very helpful to us to get that started. The behavioral health facility, behavioral health inpatient, psychiatric emergency, and behavioral health clinics have been thematic throughout our process. One of the reasons that the board recommendation included the 2 new community clinics was to do what Blue Ribbon suggested, which was to begin integrating behavioral health at a clinic level instead of having to continue to rely only on behavioral health as an inpatient or on-campus facility. So that was one of the drivers behind the notion of moving forward with 2 of the community clinics. As you also know, the Northeast Clinic has become a bit of a model for us in terms of delivery. Most of our patients, our providers, feel that we're on the right track with that project. So one of the things that we suggested was potentially in an effort to continue saving money and keep this process moving forward, to be able to start maybe with those 2 clinics and keep the motion going that we have without having to start from scratch and redesign the wheel. On-campus clinics and support services, this is the Ambulatory Surgery Center. We have renamed this now as Patient Services Center. It's exactly the same thing. There's a lot of background on this in the Blue Ribbon Committee report. Where this goes, how this goes, is really a function, though, of that decade of planning we talked about, because this facet of JPS's services have been discussed at length throughout that 10 years. From Blue Cottage, all of our elements have said, okay, future campus planning, where would such a facility go? So there's one of the reasons that committee came up now, the recommendation came up now, and not further out in the process, because the other thing that does to us is it allows us to stay within the campus and begin delivering some of the volume needs that we have without necessarily having to jump straight into the bed tower. And I know a lot of you were present in some of the meetings that we've had that help us articulate the cost of operations versus the investment in capital. And one of the things that planning and the whole board has been focused on is the ability to say, look, when we do make a capital decision, let's recognize that that capital decision, whatever millions of dollars it cost, has to be multiplied by 7 in order to serve that facility operationally for 10 years. So if I've got a $10 million investment in capital, we have to plan for a $70 million expenditure over a 10-year period to integrate into that model. So that's been one of the drivers throughout the process, is understanding the relationship between the operating costs of these facilities and the capital costs. And certainly that holds true with ambulatory service. The new hospital bed tower, as you all know, this was a 676 bed project, almost $900 million recommendation. That is a big ticket item, obviously, and it is one that we believe Blue Ribbon, and Steve, you correct me if you think I'm wrong, but Blue Ribbon wanted to be sure that we have thoroughly explored healthcare transformation and the ability to reduce inpatient demand by increasing the outpatient services and patient access, hopefully in a manner that would be able to reduce some of the demand of that bed tower. But the operating cost of that is a significant one, so that's not one that the initial recommendation was that we start on today. 4 new community health centers in the next 5 years, in the next 10 years, $80 million recommendation. As I said, 2 of these have already emerged as what we hope can be a continuation of the model that we've started at Northeast. So that's where we are with that. Robert, can I get you to do the Cancer Center piece of this? You will be much better at it than I will.
You bet. What we did at the Cancer Center is we had the opportunity to create an environment where we could pretty much almost greatly double our space, and we had the possibility to lease a facility that was a huge benefit. When the Blue Ribbon Committee initially began its discussions about cancer care, particularly where we are in our community, JPS sees an unfortunate amount of people in stage 4 cancer because they hadn't seen primary care doctors. And we want to be able to stem that tide. We want to be able to stem it through primary care, and we want to be able to stem it by having a facility that can accommodate people. So with our partnership and our relationship with the Moncrief Cancer Center, and what that ultimately leads us with a partnership with the UT Southwestern facility and where our faculty members can go and what we can do, we were able to open up on 8th Street a new facility right next to Baylor. In fact, the land is owned by Baylor, and we have a great relationship with Baylor as well. And it speaks to the Blue Ribbon Committee, the work that Trent and Steve did on cooperation and collaboration. Because our collaborative efforts now with the Moncrief Cancer Center and ultimately with UT Southwestern has really grown over the last couple of years. So the ability to have a cancer center now that increased our patient space from 22,500 to 500,000 square feet with new equipment, better equipment, we feel that we're making some significant dents and will continue in the future to make dents in cancer, particularly in a vulnerable population. So what the Blue Ribbon Committee had suggested in a cancer unit, we've already reduced that cost and allowed for great cost savings because of it. It cost us, and Lou, help me out here, it's about, where are we, about 8 million?
8.8 million.
Yeah, 8.8 million in actual cost. I could read the slide, but I wanted to call out Lou's name. $8.8 million as opposed to some of the recommendations of a freestanding building. And we're really pleased by that. Those of you who are at the opening and have gone by to see the Cancer Center can know the improvements that we made and what it's going to ultimately mean for our patients. So that's a part of cost savings that already can be baked in to the overall bond package. The fact that we didn't have to spend the money for a freestanding facility. We're proud of it, and we think we'll see an annual increase in patient visits because we can accommodate them better. That combined with what we're starting to do in our community clinics and our outreach from primary care, getting people into oncology and cancer treatment sooner and better, we think will not only save more lives, but in a better setting. We're proud of it. So I think we've made great strides in that. I don't know what the next slide is, Mr. Manias. Trent, if you want to, we want to go, or you
I want you to,
Okay, that's fine.
but thanks.
You bet. What we have here is basically a site legend, and it kind of shows you an aerial view of where we currently are and what we currently have. And I think it might be best at this point to make a comment to those of you on the board, those of you on the court, and those of you in the audience and those listening live streaming. And y'all feel free to correct me if I'm wrong, but I think as staff members, our job is to help you as board members and you as court members see what we see on a daily basis. We see patients coming in our door. We see patients going to our community clinics. And our job as staff is to do the best we possibly can to see the pulse of our patients in Tarrant County, where they're going, what they're doing, what their needs are, and where that healthcare need is going to be in the next 2 years to the next 20 years best we can. So staff is going to make recommendations to the board, and we're going to promote ideas. We in no way want to promote those ideas in any level of isolation, nor do we want to say, this is our idea, and by golly, we're going with it. We want to make that recommendation to our board. We want our board to decipher some of that, and then that recommendation comes to the court. I really see this as an incredible level of cooperation between those bodies, the court, the board, and staff. The staff, again, is going to get a more granular view. The board is going to get a view because they come to board meetings once a month and they come to committee meetings. It seems like once a day, but we try to divvy that up and not make it once a day. But they're at our facility all the time. They see our patients and they know. So they're going to see that. You as commissioners are going to have an idea of where healthcare should be going from your district, and you're going to see where healthcare should be going in regards to a taxpayer and what smart decisions we can be making. I will tell you, and I'm going to have Lou speak to a little bit of the numbers so you can follow that. Lou Mattingly on our team is part of our construction crew, and he put some of this together, so I'll have Lou come up and take the microphone as well. Do we have a microphone at the podium? Okay, so it's just a fake podium, so, okay. I'm going to have...
Before Lou gets started, I've got a question or two. The first is about this main campus schematic. We're talking about adding some pretty significant buildings to that main campus. But nowhere have I heard discussed whether or not the existing power plant can handle the additional load that we're about to bring onto this campus. It's my opinion, just based on talking with some experts in the field, that we're going to need to do something to our power plant in order to make this thing work. And that has not been discussed anywhere. I've not seen any numbers on it anywhere. I don't know that it's on anybody's radar screen except mine. Power plant is critical before we start adding patient towers and patient care centers and mental health, behavioral health centers to that main campus. We got to make sure that we've got a power plant that can handle the additional load.
And Commissioner, you are absolutely right. In fact, the Blue Ribbon Committee looked at that, and inside the Blue Ribbon Committee, they address a power plant, the need of a much larger power plant to supply all the energy that we need down there. And I think that part of that is in the costs that are embedded in the 1.1 billion, almost 1.2 billion total package. But you're absolutely right. We have to address the power plant issue.
And we would absolutely not disagree at all for the power plant and where we can do and what we can handle from a power plant standpoint. I know you had a second comment too.
Yeah, the second comment is more global and more strategic, and it has to do with planning. It has to do with program management. It has to do with expertise and bandwidth. I do not believe that we can plan the delivery of this project, this $1.2 billion project, through hospital committees. I don't believe that we can manage the process through JPS's facility or construction department. I don't believe that we can do it through Tarrant County's facilities or construction department. We need to bring in a firm that has the expertise and the resources to help us gain this project. We have to know the impact of doing this instead of that. Not only on our pledge not to raise hospital district taxes to defease the bonds, but also on our ongoing operating expenses. We need systematic planning at every stage of decision-making, and I don't think we've got that expertise in-house.
Commissioner, I agree. I think that's what we're gonna get into as we move into the next agenda item. Robert, are y'all close? How close are we ready to move into that item?
We can move into those.
Well, that may be it right there.
Yeah, and we can move into that too. To Commissioner Brooks's comments, I think the JPS staff and talking to GK and talking about the staff that we have at the county, I wholeheartedly agree with your statement. And I think we have people at JPS who are skilled and talented and can help us get to a certain level. And I think you have people within the county. I sit across from David Phillips and the others that I think have some great capabilities at the county level. That gets us to a certain level, and then you have that program coordination aspect that I think we all can agree with, and I think that's where we are.
It's not just coordination, Robert. It's planning. It's strategic. And the reason I brought it up at this point in the agenda is because you're already talking about projects that we're gonna do first, and that we're gonna do now, and that we're gonna do without having made the threshold decision about how we're gonna move forward. And that doesn't work for me.
Can I ask a question, Commissioner?
Go for it, Trent.
If, and I think we, on the planning side of the board, absolutely agree, there has to be coordinated program management, comprehensive planning included with that. Our blue ribbon sort of translation was what potentially could be done early that doesn't necessarily disrupt the process to the point that we would endanger that comprehensive strategic planning ideal. And we get limited quickly. The clinics, we felt like those met some of the criteria of blue ribbon in terms of the urgency of need and access. All of the recommendations had sort of a parenthetic caveat to it, and that was, it is assumed by, I think, most of us, if not all of us on the board, that the Commissioner's Court is going to want comprehensive planning and management of this entire bond program. And we completely concur with that. Our only question was, does it have to occur before we begin any phase or aspect of it? And if it should, then that's fair, and we just need to be in a position to, to respond to you.
And I guess what I would say is scrap whatever we're going to 4. Or 5, I guess is what we're really going to. And I think that to the question you just asked, I applaud you on the progress you've made on the cancer. I agree most wholeheartedly that you can go forward in the way you're talking about going forward right now with the clinics, where you have already engaged someone to help you with location selection, or suggestions for locations of each one of at least the 2 first clinics and maybe all 4 of them.
What we've really done is just looked at the population of patients and looked at that patient base.
So there's
That's
not been
all
any
we've done.
decisions made on that. That would come, again, would be an interaction between, y'all as a board might look at it and give us 2 or 3 recommendations, and then we sit down and collectively discuss that. But past that, I hope that, as Commissioner Brooks, I think, just alluded to, that as we get into everything else, that we do look at bringing on board, I'm not going to say a program manager. I'm not sure it won't be program managers.
Yes.
There may be a firm out there that can do everything, but I guess in the time that we've gone, and everybody, the question I get, and I know y'all are getting, is what are you turning dirt? When are you breaking ground? And what I said up until the end of the legislative session was, we had to see what they did to us. We got through that fairly unscathed. On a go-forward basis, the other thing, because through all that period, we had people, I know y'all kind of put a moratorium on people coming to y'all, we didn't. And so as a result, we had a steady stream coming through all of our doors, telling us how they can be the end-to-end all deal. But the one consistent message that I have heard is medicine's changing. Be very careful about just doing bricks and mortar. And I think to that end, what Commissioner Brooks is saying, I agree with, in that, yes, we said here's what we're going to do, but if we got folks who have a crystal ball, cloudy as it may be, on where healthcare is going, we need to at least give them an opportunity to talk to us about that. Mental health. You know, primarily what we said we're gonna do in mental health is build 280-something beds and an emergency room on the ground floor. You know, I might be as open to bringing in somebody like the Meadows Foundation and saying, is this the best approach to keep people or to deal with mental health, or might we look at it a little bit different way? And we're not, and I'm not proposing to know how to look at it, but I'm saying let's bring in some experts. I would rather be a little bit more deliberate in our time and not move ahead just for the sake of moving ahead. And that's why I believe that the first critical, you already done the first, I mean, you've already started it. You did the cancer center. You know, accolades to the way that's worked out. You're talking about the clinics. That's not going to affect this downtown hub. But I truly believe that before we make any decisions about the downtown hub, that we need to get on board that advisory team and determine, maybe within each group, certainly within mental health, I think we need somebody like a Meadows, may not be the Meadows, but like the Meadows Foundation, that can help us be sure we're moving in the right direction.
I want to be sure that we also don't forget to look at what we would call P3 opportunities on this project. There are a number of items that we've discussed that probably don't qualify, or you would not want to do a P3, but there may be some we do, whether that be parking structures. You know, that's a decision the hospital and the board and the commission need to make. Do we want to be in the business of running parking garages and building them and owning them? Maybe somebody else can do that better, and we save our capital and use it somewhere else. Maybe there's a need for a professional office type building for physicians. Maybe that's the type of facility that could be a P3. Commercial uses on the property. I don't have, you know, is there any room for restaurants or a pad site somewhere, you know, maybe on the periphery? Those are things I think we need to look at, those opportunities, and maybe not sell the dirt, but lease it long-term. You know, JPS has been here over 100 years. We're going to be here another 100. So think of, you know, think
And
of
I'm
those
hopeful
terms.
I really am putting a lot of stock in this, again, whether we call it program manager, program managers, whatever, as being somebody who's going to bring us the expertise. And that's why I'm saying it may very well be more than one. But that's what I want that group to do for us, and us not get bogged down, because I'll admit that I've heard P3 mentioned a lot, and every time I hear it mentioned, it's mentioned in a different perspective. And so I don't want us I think it's something we ask our group of advisors to look at and to bring back recommendations, but that we don't spend a lot of time. I mean, I think the purpose of the day is, what's the next step? And as we go through the process, how do we both work together in accomplishing the end goal? And I hope that's what we're gonna do today.
I'd just like to say this about how I think the program management concept ought to work. And you mentioned in talking about it, Judge, the word team. I think that is an important word in this whole concept. There probably is not one firm out there that possesses all of the expertise that we need. But firms can team up and bring the various expertises to the table under an umbrella that will give us everything that we need. And I think the key is to put an RFP out there and tell them what we're looking for, and let people respond as to how they will deliver those services.
Judge?
Charlie?
I like to, I'm going to speak as chair of the board for a moment, that, you know, the things that just brought up, I think we agree as a board. I'm not speaking for all 11, but I've got 3 former chairmen sitting in this room. I went back last night and read the Citizens Blue Ribbon Committee report. There are 5 consultants over 9 years that came together to give the information in the Blue Ribbon. I stood before that commissioner's court a little over a year ago before we went to the citizens, and fortunately they voted for the bond package. We keep talking about teamwork. I think we're starting that today. You know, we got the bond passed. We wait on the legislature at the end of May. You know, I heard the word, you know, steady stream. We as a board, based upon discussion, elected not to talk to anyone because we did not want to get involved until we knew where we were going. So the timing is perfect to put a team together, whether that's project manager, managers, and the team between the Commissioners Court, because obviously the Commissioners Court expressed when they agreed to go to the citizens, because the Commissioners Court is the ones approved, put us on the ballot, that you said then, you're going to watch the financial side of this, and you're going to look at the long-range plan. Now, over 9 years of consultants, this planning committee, I commend Trent and the committees, this board sat through everything from P3 presentations to we have sat through a lot of meetings. Most of the members of this board have been on this board for probably over 8 years. I think over half of us have been on this board for over 8 years. So the good thing is we're excited about where we are. So I think we need to, like you say, what's an RFQ, whatever we need to do, we need to move forward. So we together as a team between the Commissioners Court and the board, we show the citizens we are moving forward in a very strategic way to provide the facilities, the delivery of health care. So I think we're very supportive of where we're going. I think there are some things we could do in the short run, whether it's the home health clinics or whatever it is. But I think the big picture, I would think we need to move forward ASAP to get that
Already
done.
one RFQ.
Yes, sir.
Okay,
For me, yes.
okay.
And then I don't disagree, and I don't want to discourage y'all from continuing on your efforts toward the clinics, and doing that.
And we can
Okay.
certainly come back to y'all with a recommendation. I think staff and planning's working on that along with the board now, so
All of those decisions will have to eventually come back up to the court. for
certainly,
final.
because they're real estate driven.
So if we can talk a little bit about the RFP, okay?
Yeah.
Because I think that, I know that our courts, and I know the sentiment of the board also, is that neither the hospital district nor the county has the internal capacity or capabilities to do this. We never thought that we did, okay? And we looked at a bunch of different models, you know, there are different models for program management. And so it doesn't include just one firm. It includes a collectivity of firms, but you have to have one leader on there. And
A team.
just like the Blue Ribbon,
firms.
a lot of people don't realize the Blue Ribbon Committee, we had at least 4, possibly 5 different independent contractors
Right.
that worked as consultants for us. But it appeared as that there was just one, you know, and so that works. I do want to talk about certain things and what I think at least we need to consider inside that program management structure, okay? First of all, I think it's important that one of the rules is that whoever is part of that team doesn't construct any of the process, because
Agreed.
we don't want to have that potential conflict. And it's something that Trent said, and we're going to talk about it again in finances. But when we look at what it's going to cost to build the buildings, we can't look at that as the sole activity in finances. We have to make sure that we have enough operating capital so that we can run the facilities once they're built. And it's not like the county where that if we put a new courthouse up, we basically backfill those staff with moving them from an old courthouse. And so that has got to be we have to watch that. So an element that we might want to think about in this program management style is to not only have construction and planning people in it, or expertise, but also have an understanding of and an expertise in operating healthcare facilities. Because we never want to put either the board or the court in a position where that we build a building and then we don't have enough money to operate the building. And I'm not talking about paying the utilities and everything, I'm talking about the services that JPS provides. So that's going to be a critical analysis. That will style which programs go first and which ones may be somewhat delayed. Now, there's other ways to skin that cat also, but quite frankly, we need to have that financial knowledge to be able to do that. And I know that is a real concern of Mr. Early, it's a real concern of the hospital district board, because they need to have that.
It's got to be heavy on financial modeling
So
that we can make decisions based upon real data.
So what we would recommend at staff, only a recommendation, and it's going back to what the judge said, that let us begin to build that RFP. But that's not something that staff, either at JPS or definitely out the county, makes a determination that's the way we're going to go. Let us give you something to look at, see if we capture what needs to be in that, because that's going to be a national firm that's going to do that, or firms.
Maybe not.
Well, remember, we're probably going to have more than one firm in that umbrella.
And there are enough local firms with various pieces of expertise.
Absolutely.
But we're gonna have, we're
Let
gonna
the market
debate,
determine that.
we're gonna determine that at the point that we get them in.
That's right.
But I think the important thing right now is to prioritize that we're gonna get that, we're gonna have a draft of that RFQ by a certain date. We're gonna get it out. We'll see who comes back. And then collectively, we'll determine who we feel the best one to proceed with that. I hear everybody on the same page with, if y'all, I ain't got any wallflowers in this room. But I will tell you that the five of us up here have no problem saying what they think, especially if three of them can squeeze in over Roy and I. And Thickens will do all right, and, we'll get there with JD's just been here long enough that he's heard all this BS before. And he just.
That's what I said next to you.
Yeah. Well, he's out of place. Of course, there's a lot of y'all out of place today. But that, I think, I hear everybody saying RFQ. I don't want to leave this meeting with there not being some understandings of what's going next.
And it's either going to be an RFQ or an RFP.
Don't care, but I want a draft of it. I want to leave here with an idea of when we're going to have the draft, and then when the draft's going out. And then when is it coming back in, so that we can say that by X date, in my mind, X date would be no later than the first of the year, we've got somebody on board that says we're going forward.
TJ, we've been talking about this RFP, RFQ, whatever it is, since at least the 1st of January.
So as we drill down into preparation of that RFP, what I'm hearing is that the combination of the staffs will work together to prepare that RFP. We may need to have some outside assistance, even in the preparation of the RFP, to make certain that we have addressed all these, because there's 4 elements of this that we see already necessary: facility planning, operating costs, accommodating facilities or the financial modeling, healthcare culture and best practice, transformation changes, and methodology of construction, GC, P3, CMA,
Agree
CMA
100%.
risk,
That's
all
right.
those. So if
All
those
those.
are all in the RFP, does that cover the intent regarding the RFP selection?
I'm not so sure when we put that together that it's gonna take that long or that long time frame to put this together. First of all, on those points that you raised this, Trent. I think that there are some models out there already that we could gather and look at to help pull that together so that we would not have to be in this process so long. Some of the board members took some trips and visited some facilities where they've already accomplished the total end product. And I think maybe we could reach out to those areas to see their RFQs, to see what they did to pull together to assist us in pulling what we want to do.
I think that's a very good statement. I think that's fine. All I'm saying is, if we can have it done by November the 1st, great.
I like November the 1st.
But I'm gonna tell you, we get it done by November the 1st, that will, getting the RFQs back in, evaluating and approving them, then great accolades. Then we'll all take off November and December for the holidays, and we'll get ready to go to work January the 1st. Don't get me to January the 1st and not have somebody on board.
So, let me make sure everybody understands what we're talking about here.
Yeah.
So the creation of the document itself and the approval by both boards, that we can put it out on the street sometime in October or November, early November. And then hopefully, you're not talking about that, Judge?
You better have, if you don't have it done by if you don't have it done by early October or before middle of September, remember, court.
This is the middle of September.
That was 2 days ago.
Well, okay,
Trent, be sure GK's
if we don't
responsible
have
for
it
this.
done by the end, here's the problem. December the 10th, or somewhere in that vicinity, will be the last meeting this court has this year.
Judge, we're gonna try to get that thing to you all much faster than that.
Great.
You know?
Then we're on the same
I
timeline.
just want, I think there might have been some confusion as to what January
Time flies
1
when you're
looked
having
at.
fun.
And so let us pull it into staff. We've got, let us do the first deal. It's gonna be important that whenever we begin to give you drafts to look at, and what you have to look at, quite frankly, is the scope of services. And make sure that they are definitive enough to do what you're looking for, okay? We don't need to talk about what those are now. You need to talk about that when we have those drafts coming to you.
And if we have the drafts 3 days before our next meeting, we are to be able to make any comments and approve them and be ready to go out.
Sounds good to me.
Okay, so you're talking about 3 days before our next court meeting?
Well, whenever you give us that draft,
Oh, I'm sorry, I thought you meant by the end of.
by the next court
by
meeting, we ought to
Friday.
be ready to vote on it.
Okay. I think we all understand.
I think it's important, though, to keep in mind that being thorough and putting it together correctly is really more important, whether it's the first week of, or the middle of November, the first part of November, the end of November. Okay? I'd rather have it done right than have it done hurried, okay? And not be right, and leave something out.
And Trent, I agree that I hear what Reverend Emerson is saying. There may be some examples out there, but I also don't have any problem whatsoever in spending some money to
Get some
get.
help.
It's your money, we're gonna spend it for you.
Yes, sir.
We're glad to do that.
We understand.
I'm tempted to say, with all deliberate speed, but Brown v. Board gave a whole new
Not that one.
definition of all deliberate speed. I'm not sure we've gotten there yet.
No, and I think we also need to remember that in some of the regular updates that we've received in court about this is that we've been told that we're working on an RFQ and on an RFP. That's what we've been communicating to the community. So we needed their support in order to pass the bond, so we have to make sure that we're not misleading them in how we're communicating updates about our process.
Judge, if I may say for a point of clarification, Trent mentioned the prioritizing those 4 elements in the RFQ, in the scope. But GK, your staff will take the lead on putting this together, just so we know.
I think we need to understand that this is going to be a joint effort between JPS's staff, and we'll provide.
But you'll be, okay.
Yeah, we'll get that to where it needs to be.
Perfect.
You know, we are going to talk about communications a lot more, because you raised a very good point. We can either talk about it now, or we can talk about it as we go down the agenda.
I'm all for following the agenda. I know sometimes we do that, sometimes we don't, so.
Amy,
That wasn't the hospital board, that was commissioner court, right? Point of clarification.
so, okay, so we understand.
Okay.
Okay, we understand, and that's a takeaway. And we need to get on it, and I know Robert has done some work on trying to identify some experts, and we need that, and so that'll be good. So there's a takeaway. So, then the question becomes, if we're going to do this, are there any of these activities, and we already talked about this, are there any of these activities that were identified in Blue Ribbon that we can do now, that we know we're going to do, that's not part of the centralized campus? And so, you know, we've discussed clinics. Is that something, and we've always talked, and Blue Ribbon talked about the fact that the Northeast Clinic would be at least the beginning of the model of what the clinics could be looking like. And also the fact that, and Robert mentioned it, that we were going to beef up psychiatric services or mental health services in those clinics. Is that something that you would like us to begin to do now, so that, or do you want us to wait for the program management group to come on board? And if you do want us to begin looking at those two clinics, then tell us, and we can start that planning process and talk about a bunch of different things there. Bring all those ideas back to you, but give us some guidance. Give us your comments and guidance on that.
I'd like to hear the board.
I definitely think the two clinics, you know, I think there's a process in place that we're already pursuing those. I think we should continue pursuing those absent or separate or parallel to the RFQ. I also think the ambulatory surgical center, or whatever we're calling it now, patient care center, you know, that is something that I think we're ready to do. I'd rather see us do that sooner than later and not delay.
I agree in principle. But every decision we make has an impact on every future decision. And by picking low-hanging fruit, perceived low-hanging fruit now, we're making decisions that may impact us way down the road. And I'd like to know what those impacts are before we make those decisions. Sure, we can start the planning, but I would not like to get too far down the road without folding this into our program management structure so that we know what the impacts are.
Commissioner, I don't disagree with the long-range strategic plan of that, but JPS has needs today. We went to the citizens to support that need by passing a bond package. I do believe there are certain things, again, not part of the global, but there ought to be certain things that JPS has been working on for years that we should be able to move forward on. And again, whether it's just one clinic, two clinics, and again, where do they fit? Is healthcare changing? I think the RFQ is going to come back with a lot of that, but I think just for us to put everything on hold, waiting for an RFQ to come back maybe in January with scope that maybe not even have their final reports where action could be taken to sometime this time next year or the following year. I think there's certain things that JPS could do in this interim period that ultimately will benefit our patients, which would also ultimately be a part of the, whatever the, and we totally agree in the teamwork, let's plan this thing right. But I think there are certain things that the JPS planning and JPS board could certainly work on. We don't determine all those today. We can come back to you with some suggestions. But, you know, again, Steve, back to your comment, I think there are a couple of things that we can move forward on.
Commissioner Brooks, let me ask you, and Commissioner Allen addressed one of your comments as well regarding communications and RFP/RFQ. But I want to go back to the clinic because I want to try to figure out exactly what JPS and the county should be doing, and so we're in sync. All indications to us, when you talk about low-hanging fruit, and that's a definition of term, but low-hanging fruit is to figure out your impact in a community that's ultimately always going to impact what you have at any campus or any satellite. So what we've done through planning and the Blue Ribbon Committee, even dating back to 2009 and the Boca Powell Plan and everybody, no one's disagreed with the clinic aspect. And the clinic aspect will help clarify the determination of what you do at any main center, even if that main center is to be relocated, changed, or due, and that is to provide primary care through mental health and primary care as strong as you possibly can to deal with what's coming on campus. So we've gone through sort of the planning discussions, we've gone through all the reports, and that is the one that glaringly comes through in every report. How do you and the court feel about those community clinics and the movement of that based on what we have in the Northeast as the beginnings of a model? How do you feel about that, or is the court's view wait on those until that program management
I don't
aspect?
think it's a wait on those, but I don't think there's any way, since you have not even identified any pieces of land on which to build these clinics, I don't think there's any way that we're gonna start construction on clinics before we get a program manager in place. It's just not functionally possible.
Well, and I don't disagree with that, but what we said earlier and what I still believe, they do have folks that are looking at centers of population. I don't feel like they need to stop everything.
I didn't say stop.
Well, maybe I mistook what you said, because what I would suggest.
I told Steve, go ahead and do the planning.
So what I would just suggest is that you move forward with the clinics, and that if we have, which I hope we do, have our program, whatever it is, on board by January. The one thing that I would ask of them is, do we think the clinics are gonna be a draw on operations? Or are they going to be a break even? Or are they going to increase operations? And as long as they're not a draw on operations, then if they're a draw on operations, we gotta step back and have a conversation. If they're a level, or if they're increasing operations, or increasing in a supply of revenue, then we're moving forward.
I think another issue you might want to just think about, and Robert, you were very involved in the purchase and the looking for property in the Northeast area. And as you know, we bought a tract that's probably twice the size that we needed because it was available at a good price. So we have a lot of opportunities for other uses that we've had discussions on. I think you need to think if that's gonna be something you wanna look at when you start looking at these clinic sites. Do you only wanna buy a 3 or 4 acre tract to build your 25,000, 30,000 foot building? Or do you want something a little larger where maybe 10 years, 15 years, you might have a totally different use? Maybe something in the senior use for senior citizens, or, you know, whether it be an assisted or a full care type facility. And again, that gets back to the planning that Roy's talking about, Commissioner Brooks. So, you know, you might, instead of just jumping out and having a realtor say, well, here's, you know, this track works and this one works, and, you know, and there's no room to do anything else. I mean, I don't know if that's even something we want to think about, but when you start talking the scope of $1.2 billion, you know, there's probably funds there to buy a little extra land for something in the future.
So, Robert, I think you somewhat spoke to this, but to provide historic context, there had already been conversations about neighborhood medical homes or clinics or whatever we're calling it prior to us getting to the point of putting together and putting before the voters the bond, right? Okay. Based off of just what we saw as the need, based off of our growing client population.
Yes, ma'am.
I would like
Well,
to.
Reverend,
No, Dorothy was.
Go ahead.
I would just like for us to remember that we talked about behavior health, bringing in someone to help us look at what behavior health. I think it's gonna be in the community, so I just want us to be cognizant that we need to have that piece too, because it will impact what you build in the community.
Yeah, I just want to mention that, I know we talked about, as we look at, we go forth with the community health centers, great. But also we need to consider not just population, but we need to look at the healthcare trends that are taking place right now. And so before we jump up and build that healthcare neighborhood health facility, what's the trends that are taking place? And who better knows that is JPS staff. You know, attending the American Hospital Association meeting, one of the big things that the discussion is those other agencies out there that are now building community health centers, neighborhood centers. CVS is slowly moving to that area. So we would want to look at, you know, if we build a neighborhood health center here and then CVS has two there, did we make the wrong move? I just think we just need to really involve staff to look at what those healthcare trends are as we go forward to build those neighborhood health centers.
I have a question on that point, because I think one of the keys to understanding that dynamic on the financial plus or minus regarding community health centers is services and scope. Because I can tell you that if we replicate, Robert, you tell me if I'm wrong, but I don't think I am. If we replicate what we have done at Northeast and all of the other community clinics, that will be a negative impact on operating cost. It will not be a break even, it will be a negative impact, unless part of your charge to us is to look at potential other revenue streams that could be used to supplement services within those facilities. Because what we've talked about now for 3 years in our budgeting process are how do we begin to diversify our revenue streams to be able to bring additional dollars in to help us support these new capital expenditures. So I think one of those, and I realize that's a touchy discussion, but I think to the extent that we would like community centers to move from cost centers to potentially break-even centers, I don't think you can have that discussion without being willing to look at additional service lines within those. Robert, is that an inaccurate statement?
No, you're right.
And I think what you're saying, along with what Commissioner Brooks is saying, is that y'all moving forward with beginning to identify locations that certainly by the time that has occurred, this program group is going to be on board. And I think we've all heard that a major role in that program group is going to be using that cloudy crystal ball to figure out where revenue reimbursement is going to come from the federal government and how that's going to impact. So I think what we're saying is move forward, and I know that I don't have to worry about y'all getting it all done before January. We just, you know, we could err to be that the problem. Okay, I see that we seem to be maybe somewhere around 5C. And I'm going to just make the gross assumption that we've covered everything above that. So let's talk about the overall management structure.
Yes.
Oh, I'm sorry. Can we go back? Did we answer the clinics? How many? Are we saying 2?
Well, there'll eventually be 4.
Right, but there's a question here. Clinics, how many? Which I don't know that we said that, or if we did, I missed it. So what are we saying? How many?
The only thing that I heard was that we're going to move forward with the RFP, but during that process, the JPS is going to do the planning aspect of different locations and what services might be involved in those clinics.
Okay.
As far as the number, that would still be
We're not-
something that would come back to the Commissioners Court.
Okay.
through the board.
You're talking about site selection possible. We got to come back to the Commissioners Court for that anyway.
Yeah,
And there
the
may be-
assumption was 2, based on site selection
right.
activity.
There may be all kinds of elements that, Commissioner, that would make a difference. For example, when the Northeast facility came and we drove around every part of the Northeast, we actually got a fairly good land situation with where that was. We may have a situation where the philanthropic donation matches where that population growth goes. That makes a big difference. It may also be a big difference as to whether you put that clinic where you have an existing clinic and you expand it, or it's a total freestanding and JPS does not have a presence there. That's going to make a big difference too. And
But
so
let's
I
be
think-
clear. What y'all may be looking at right now is 2 locations, or for 2 clinics. But the bond package called for 4. And it was one of the things that we felt like was critical to getting support. So I don't want anybody to leave this room thinking we've scrapped 2 clinics
Right. No.
somewhere in this county.
No, sir.
And it may very well be that we make the determination that we build all 4 in the beginning, or all 4 at the middle, or all 4 at the end. But we're talking about 4 clinics. And you're right, the 2 that has been, there have been 2 mentioned right now, but I think that's simply to say we can begin some of that work without, but now we're saying that no, it'll be under the preview of this program group 2. But, and it may very well come back that they say, pick 4 locations, let's go.
We may have to do all 4 to offload before we build the hospital. Because otherwise,
Yeah.
the capacity won't be able to withstand that.
Sure. And I'm certainly not suggesting that we do air math, but I think, Trent, you answered my question. You said the assumption at first was for 2,
Yes,
right?
ma'am, correct. That's the direction we've been headed, was 2, but that site selection didn't necessarily be limited to 2, knowing that 4 was the
Right.
plan.
Right.
Okay.
Yes, ma'am.
Great.
Yeah, there's a board vote for 2.
Sure.
Yeah.
Yeah, I mean, the purpose of this meeting is to gain clarity, so
Good.
still with the how many question mark, just making sure I
Right.
understand and that the listening audience understands how many we're talking about.
Correct.
Okay,
So we're initially focusing on 2.
very good.
But
Site selection.
nobody leave this one, I don't wanna hear in the paper tomorrow that we've scrapped 2 clinics and 2 communities are gonna be left out.
The Blue Ribbon Committee actually said do 4, but understand something, that because of the population growth of the county, you're probably going to be building more than just 4 new clinics.
For clarification, the board's never discussed less than 4.
Never.
Okay.
I want to make that point very clear.
So if there's anybody in the media in this room,
So we then go to the overall management structure.
It was a hand gesture for the media. It's 4.
next, now, I think.
Now 5C.
So, I think it's important that we begin to talk about the roles of not only the Board of Managers, but also the Commissioners Court, and how decisions are going to be made as we move forward. Let me first say that when we come to management elements, as far as the day-to-day stuff, that'll probably be on a staff level. We want it on a staff level. But decisions and how those decisions are made and how they move up, I think it's important that both governing bodies have a clear understanding as how that's going to happen. And that's why we have this on this. We could have also entitled it, overall decision-making structure. So I'm going to be somewhat presumptuous, and the court obviously can correct me. But the Commissioners Court wants to be intricately involved in the overall decision-making process. They have taken the lead as far as the bond package is concerned, which everybody knows we were very successful in it. I think Commissioner Brooks spoke a little bit about it today, that we don't want that decision to be made by the time it gets up to Commissioners Court, that we want to have input. We also recognize that the board is the appointees of the commissioners, and the commission has great, and the court has great pride in the board members that they appointed, and confidence. So I think that it's important that you all talk about that, because the last thing we want to have is, if the court is interested in being part of that decision-making process, to come up to Commissioners Court with one final recommendation and exclude them from the process, that we may hit a snag on that.
And that's not what we intend.
Yeah.
So let's talk about what you all intend.
Well, I think the intention we have is make sure that that never happens. And two, go through the process that's been given to us from a board standpoint, that staff begin to look at the various options, and that is at least initially discussed at a planning level. So the planning level plays an intricate role with the finance committee and kind of see, is there viability? Are those 4 ideas even viable? Should there be 6 ideas on the table? And begin to do that. Then begin to discuss that at the board level, which gives you a domain, gives you an area to deal with, and then make sure that we come to the court with those various options. At the same time, in the process of that, I don't know if GK wants to admit it or not, but we've become a whole lot closer in the last 6 months. We see each other all the time, and I don't know if that's healthy, but we are meeting and discussing and talking all the time. We discussed whether there was a 5C or a 5J on this, and we went through, y'all stop looking, there's not a J. So as we went through that process, we have a very good working relationship, and we'll have that good working relationship with county staff and JPS staff, so that nothing gets to you and says, that's the definitive answer. Now y'all decide whether you want yes or no. It'll be a process through there, and we're going to have the luxury of board members that attend national functions, board members that have been at JPS, board members have a huge stake in that. We bring those options to you. So there's a process, but you all are included from your staff standpoint and you yourselves at any meeting. Of course, we have to be cautious about when there's too many of you in one place, it makes too good of a thing. So we want to be cautious about that, but at the same time, your staff is invited to every one of those. So there's a process.
I think in the communications line, it's going to be extremely important that, especially for your committees, finance, planning, that our staff or that we are at least emailed on when those meetings are going to occur, what is going to be discussed. And if we find that there's 3 of us who really want to be at something, we'll notify the clerks and we'll post the meeting, and
Sure, good.
there will be.
Yeah.
This all goes back to what Commissioner Allen was talking about as it relates to communications.
Yep.
And it's not just communications internally, but how we communicate the process and the progress that we're making externally. And so let's jump to communications just a second. We have to have open meetings where we discuss these things in an open forum. And we need to make sure that we film those meetings, that we put them on a website, that we can point to, this is what we're doing on this program. Over-communicating is much better than under-communicating. And so we need to think about not just how either the Board of Managers or how the Commissioners Court communicates, but how we communicate as a group. Because that was the one thing that we had a tremendous positive feedback on the Blue Ribbon, is that everything that we communicate, every meeting, every document that we had, it was automatically put on websites where people could look. So moving that, the key to it is no surprises. We don't want the court to be surprised, and we don't want the board to be surprised. So when you have that type of openness, you get to accomplish that.
So in that end, whatever we're posting at JPS, let's also post at Tarrant County. Let's have it both places.
That's a good idea, Judge. I think that's.
With regards to back to the operation, before we get too far away from that, is my thought is your purchasing or procurement area will run all these things. It's your money we're spending. We got to approve it, but it's your money that we're spending. And I would hope that the way, at least in my way of thinking, whenever you're going about selection, that ultimately what y'all, maybe the court, and they'll tell me this real quick, they're not bashful, wants to see every cotton picking one that comes in. But if you get 10 bids on something, my guess is the court's going to want you to narrow it down to 2, 3, 4, and then we're going to want to sit down and listen to those 2, 3, 4 and make a decision. I don't think we're gonna wanna hear 10. I know we're not gonna hear 1. And it will come out of whatever laws y'all are under in your procurement area. Because that's where I think we have to be.
Judge, and I think also a part of that process would be the newsletter that we get from you, Commissioner Fickers. I know I get those in my email, that I think updates in those newsletters on the process would be helpful to the community, because that goes out community-wide, am I correct? Yeah, I think that would help. I think I was listening to what Devin was saying as far as the communication, is that the community knows what those processes are at the same time.
And maybe what that simply means is that within my newsletter, every time I send anything out, it'll say, here's where you go to see every document, to see every meeting, to see any communications that have occurred with where it's mentioned JPS bond package.
Right, I mean, I think as frequently that we, and efficiently as we communicated to the community to encourage them to support the bond or to educate them about the bond, we're gonna have to do that much more to provide updates on where we are with the bond.
And there's already the beginning of a portal started with the Yes to JPS
Right.
pages and things like that information that is out there for the community.
And we want to put a link on our site to that. We just need one area, but we link to it so everyone can go to it. And Robert and I were just speaking just shortly. It's going to be critically important that once a month we get a detailed report up to court. From Robert or whoever, or the president or whoever wants to do this, to make sure that we talk about where we are and how we're moving forward.
The chairman of our board would love to send it to you every once a month.
All of them over there stopped making eye contact with me when he said
Well, and
that.
I'd
so-
like to suggest also, even though my colleagues may give me some heat for being the rookie for suggesting this, but I do think that we need to have regular joint meetings, just as the one that we're having today. I'm not going to suggest how frequent we should have them, but they should be regular.
Commissioner, I totally agree with that. I was going to make the same comment. We've been together twice. Very important when we got the entire report of the Citizens Blue Ribbon Committee. We met in this room, and we accomplished a lot together as a team. We pretty much, except for probably 2 new board members that's joined us in the last year, we're pretty much the same board that was here then. So I totally agree with you. Having these periodically, I'm not saying quarterly, I'm not saying whenever. I think we all agree with transparency, whatever we can do to make sure whatever happens is certainly out there. Because at the end of the day, it's not just JPS money, it's the citizens' money also.
That's right.
The citizens' money also. So I think we need to be certainly, we're all into that. The only other comment I would say, I'm gonna take a second and say thank you, that it's not really to y'all, but we have a board meeting and 4 scheduled meetings at JPS. Those meetings usually are anywhere from an hour and a half to 2 hours. We know y'all are busy at the court, but I look around this room, I know most y'all staff members, because over the years I've met them. I want to say thank you. Your staff members attend not only the board, I'm not talking about the appointees, I'm talking about your staff members. They attend the boards, they attend finance, they attend planning, they attend. So again, I would also ask you to continue to encourage them to be at those meetings, because I think they're there and a part of it. So I say thank you for the time you let them come spend with us. You know, JPS is a voluntary board, and when you add up all the meetings, I appreciate what this board does and has done to get us to this point. It's exciting now. If we can't team up together and go deliver outstanding facilities to take care of our patients, we all need to rethink what we're doing.
What's next on your, are we still on C? Or, excuse me, are we still on C, or are we about to move to D, or are we still working on E?
I think that we're now going to move to D, because I know everybody wants to have some further closing comments on E. Okay?
Okay?
So, this was something that I asked to be placed on the agenda. You know, finances. We have different revenues that are available on finances. We have the ability to sell debt we have the ability to utilize part of the future fund, and possibly some other revenues that the district has. When you look at the economy of the United States right now, the interest rates that we're paying for debt are extremely low. We still live in an environment of an inverted curve, which means that long-term money is actually cheaper than short-term money. And I really think, because we are going to be incurring expenses that can be paid out of debt, that we should seriously consider selling a certain amount of debt now. It does two things. It allows us to cover the expenses of any consultants that we may engage, any planning costs that we incur, and at the same time, you know, it's almost a double-edged sword with the hospital district's tax rate. Your tax rate is almost nil when it comes to interest and sinking. You don't have a debt rate. And to establish at least something in that category, as values grow, then the ability to capture INS revenues will increase. And eventually we're going to have to sell debt, but I'm suggesting that you seriously consider, rather than going into cash reserves or a future fund, that we think about selling a certain amount of debt that we can afford in our budgets, so that we will be able to use that money up front. At the same time, establish some type of an expanded rate in the overall tax rate. It's a smart thing to do, in my opinion.
I would say wait till we get our program group on board, because if we take any money we're not gonna take any money right now because we just approved the budget and the tax rate. But as I commented on when we had the presentation, had we pulled any money out of operations and put it over to debt service, it would have done nothing but increased our deficit. It would have required us pulling out of reserves. And I'm looking at interest rates like anybody else would look at them. I don't know what's gonna happen. I wanna wait till that cloudy crystal ball comes on board. But I'd borrow money just for, while it's a low rate that we're gonna be paying, it's a lower rate that we're gonna be earning.
The reason I say that, and I don't know how to go back and look how the bonds were worded. But I don't know if we can sell debt to pay back expenditures that we incurred even on the planning group or the program management group. And so we need to really look at that, because those type of costs are costs that can be covered by debt.
Well, then let's look at it, but I'm not ready to borrow money yet.
I agree with that.
I had to make my pitch, because
I appreciate your pitch.
because we're picking up money at less than 2.5%, 2%. I don't know how long we're gonna see that we keep that kind of interest rate. So, can we talk about communications? I think we need to be fairly clear, at least staff, whenever we walk away, that we talk about the website issue, the different things that we're gonna put on that website. I think, as Robert and I were talking a little bit, I think it's gonna be important that JPS come to the court on a regular basis, on a monthly basis, just to give us a briefing, and that we continue these meetings. That's what I've heard. And everything we do in a public forum and documents that are public documents, we post on the website. And we can also utilize the newsletters. The newsletters cover a lot of different people. And to keep that word out there. The other edge of that sword is that we have to make sure that we maintain the momentum. Because once it's out there, People are gonna watch that, as they should. So, Commissioner Allen, do you have any other comments on that? I know that was an item that was of particular importance to you.
Yeah, I mean, I would imagine that just as there were, the town halls or listening sessions or whatever leading up to the election for the bond, that when we have a substantive update to provide the community, that we would do rounds of those, however often that we see that they're needed. I think just making sure that if we do, have the websites and things like that, that they're updated regularly, which I'm not saying that's been an issue. Once we kind of did that initial update, it seems like things are being updated regularly. But there may be other things that we figure out are effective ways of communicating updates to the community. I just want to make sure that we have the commitment that that's what we're going to do. And to your point, GK, is that does open up accountability, but that's not a bad thing. We did ask taxpayers to support millions of dollars, so I see it as our responsibility.
I do think that, and I appreciate your comments, and the taxpayers have not only a right to know, but it's more than a right to know, because their buy-in is critical. Where those patients go, how they get their health care for the future. This is all about patients. It's not about buildings. It's not about who's in the buildings. It's about taking care of patients. So the more we communicate, the better. The luxury that we have on this is I think the county has an excellent communications team, and I think JPS has an excellent communications team. I think they'll work together very, very well, and that will transcend to updates to your staff so that so that you can direct when you have your town hall meetings in your own precinct, you can direct. And I think those are going to be hugely helpful. So I look forward to the communications piece. I think that will run smoothly. And you can give us suggestions because you're going to be in your precinct and you're going to hear, they just didn't know, or wow, that was really good, that was really helpful. You're almost a mini focus group to what's working and what's not, and that will be helpful to hear.
You can count on it.
Could we do a couple of things? One, let's have a target that says if we have a meeting on today, that by a certain time frame, whether it be 1 day, 2 days, 3 days, we have loaded on our website every document that we reviewed, and the meeting is up and running. And might we even put something that says if you want to be notified when there's an update to this file or to this website, that we'll send you out a little thing that says something's happened. Come look and see what's happened. And I don't know how easy that is. It may be totally unrealistic.
Just put a notice on the front page of the website.
Yeah.
Let them come to look at the website.
I don't think that's unreasonable.
Or a Google alert. My wife has Google alerts on half the people in this room. So if y'all go out and say something, I'm gonna know it.
Man,
Yes, you do.
I don't think we have to worry about you, JD. I haven't seen you on any of Google.
You'll hear
alerts
from
yet.
me if I've got something.
Yeah, I know. And it's,
everybody's trying to figure out which house they're in right now.
so, I think if Google Alerts does it, or whatever it is, but let's do something that is very proactive about letting them know.
Sure.
Whether it be on the website, but let's also be proactive in not letting a meeting slip by. Somebody needs to be responsible for making sure that if there's a meeting in the planning or the finance or any place else, and the bond issue is mentioned, that segment is put on our website.
We'll do I think we can definitely commit to that, and so I'm sure GK and the team can as well. And I think that, and just hypothetically speaking, let's assume somebody doesn't get Google alerts or utilizes that system, hypothetically speaking, what we'll do is get information out to those as well, and we have other means by communications, and we will do just that.
What have we, Zim, good.
I'm one of those newbies on the board. I came in during elevator time. But in listening to the discussion that's going on, I get two senses. Number one, the Commissioners Court wants to be infinitely involved in the planning of this project and in the communication thereof, and I certainly agree with that. But I would caution you that a lot of communication and a lot of involvement is not gonna make this process go fast. And you gave us an unrealistic time frame, I think, for having this RFP put together, in that this is gonna be a complex RFP or RFQ to write. And it's gonna then take a while for the people that we send it to evaluate it and put together a proposal to respond back to us. And then it's gonna take some time for us to evaluate all of those and then come up with a set of candidates that we wanna bring to you. So I'm just saying, January 1, I wouldn't sign up for that if I was the chairman right now, okay? It's gonna be very difficult because normally it takes you 30 to 45 days to write a good RFP. And if you don't write a good RFP, it's in and out, and we're not gonna get the responses back we need. So we need to be very careful that that RFP or RFQ does exactly what we want it to do. I sat on the city council and time again, we would go in and say, look, we're doing away with all the bids because they didn't answer the question we were asking. Well, it did answer the question we were asking, but it didn't ask the question we needed to ask. So we need to be very careful, and so I don't want to see us rush to some determined time and not get the kind of quality inputs we want and are asking for. So that's my caution, warning in my business. That's when the red light comes on in the cockpit. So I just would caution all of us that this is very important. And it needs to be done right, and if right isn't January 1st, well then, so be it. I just want, because you talk about things showing up in the paper, tomorrow it's gonna say, we're gonna have this decision by the end of the year. We may or may not have it by the end of the year.
I don't disagree with that. I don't disagree with that. I was told that January 1st was way too late.
It may well be too late from some aspect.
I agree.
Okay,
Let's just,
I'll quit
if you need
preaching.
to come back and give us a different date, come back and give us a different date. But show us progress to
You
that
bet.
point.
You bet. We
Other
totally-
comments, or,
totally
I
agree.
mean, now, let's talk about what we didn't talk about.
Well, I have one question regarding the behavioral health conversation and what I thought was okay to continue planning efforts. The idea regarding Meadows Foundation or some similar group to begin providing input on behavioral, is that a yes or a no?
I would tell you that, just my perspective, I think talking to Zelia and others in that area, it is a different structure. And to have the ability to have the expertise of somebody who is in behavioral health is critically important to us. And that is one area, obviously, like any of the S, you don't want to make a mistake. But JPS is the epicenter to 1,500 to 1,600 patients a month that need us to be good at all times and need us to be really good as we go forward. So I would advocate for at least that knowledge base, whomever it is, Meadows, who I've seen some of their work throughout the nation, but to Trent's point and to Dorothy's point, being able to at least look at that niche would be helpful for us.
Yeah.
And that's incorporated in the overall.
Right.
But to have that segment by which we say, we're going to have a portion of this RFP that will address the behavioral health side, and that's going to be a slight bit different.
And
I
I
support
think
that.
that's important and probably the way
Yes,
to
sir.
do it. We don't need a new blue ribbon panel report
No.
on how to do mental health.
I agree.
We need somebody to look at
Function.
what we're thinking about doing and make suggestions
Yes, sir.
about things we haven't thought about the proper integrations between behavioral health and physical health. Because it's got to be an integrated care model.
I agree.
You can't do behavioral health in a vacuum.
I totally agree. And I appreciate that attitude, and I appreciate your comments. It will be helpful to us.
Commissioner Allen, were you
Thank you,
gonna
Trent.
add to that?
I was just saying I support that.
The other thing that I would say, I agree, Commissioner Brooks, and I'll go forward on that. right now, we have a number of people who are sitting in our jail with mental health. And I think we've got to at least, while you may not have actual physical hold of those people, you're interacting with that and you're working with it. And so I think it's important that as we look at the mental health, we look at those that are coming directly in through you, those that are coming around you, and then ultimately back to you because of, you know, how they're picked up or how they're identified.
Yes, sir. I agree.
And so I think that that's where Meadows can help. And again, I feel certain that nothing we've said here today is going to happen so quick that this program group isn't gonna have an opportunity to give input into that decision.
Appreciate it. Thank you, Trent.
Any-
Judge, I just think one thing that needs to be maybe discussed or brought forth, if not today at a later date, and I think the community would need to know this also. What is the process of approval for whatever we do? Is it JPS Board of Managers receives whatever bid, whatever document, we approve it, and then we send it to the court, or we review it, send it to the court? I think it would be good to know what is that protocol.
What I heard earlier was that when it comes to recommendations, I mean, when we talk about, we're really not talking about bids. We're talking about architectural, we're talking about construction.
Yes.
We're talking about advisory services. Then what I would look for is the board to give us, out of all of the bids that they've got, that for them to identify who they believe to be the 2 or 3 top firms, whatever, and they send that to us, and then we would go through the same process that y'all went through and ultimately decide, here's the people we're gonna pick to do the job.
All right. What committee of the board is going to do that?
Historically, it has been, it starts at the planning committee. It goes from the planning committee, and then it goes to full board discussion, and full board, it goes on from there.
Well, actually, we hit finance.
Finance.
Hit
Finance
finance
has a
too.
piece to it.
Planning
Yeah.
and finance, and then it goes to the entire board.
Yeah,
it comes
has
to the
a
board,
board.
so-
I'm going to want to have a comfort level about the diversity of the persons making those cuts.
Yeah.
Well, if the full board's on there, that'll be the full diversity of the board,
I'm not hearing that.
okay? What did you not hear that I just
It
heard?
goes from planning to finance to full board.
Yeah.
And then full board would give us
Recommendation.
2 or 3 recommendations.
Yes, sir.
Whereas opposed in the past, it's been, here's the deal,
Right.
which comes to us. And so all we're saying is, y'all will need to narrow it down to 2 or 3. If you have 2 or 3, and if the board says, these are the only 2 we feel like are capable, then that's where you'd be, but we want choices.
Commissioner Brooks, is your question is what happens when it gets possibly not through finance or through planning to ultimately get to the board? What happens in that selection process? Is that,
No, my concern is that those persons who are making the cut down from 10 to 3
right?
be sensitive to the diversity of contractors and business persons in this community, and not be just a group of good old boys.
I would address that somewhat. One is that, and we can refine that to a point, but the key is when it comes to planning, actually, it's a step before planning. And that's what we need to talk about, because there is a body of persons who have reviewed it. So when it comes to planning, we get documentation if they met the MBE, WBE, and all of those particular areas. And then we raise questions and make a decision from there. Then from there, planning goes to finance to say, can you pay for it? Okay, but that process, what you're raising, I think we need to go back and take a serious look at that a little bit more, because we need to talk about where the bid's gonna go to. Okay, and that is the key. So once the bids get into JPS, who do they get to? And then from there, they come to planning. And the planning is that committee, and actually Dorothy and I both sat on that committee, so.
I guess the only point I'd like to make is the judge said earlier, the difference between 2 and 4. I certainly wouldn't want the room to leave Commissioner Brooks, and the only way to get a contract at JPS is to be, quote, a good old boy, unquote. There is a process, and like I said, Ralph and Dorothy have been part of that process. I think if we could review that process, but it goes through 2 committees before it ever gets to the board. I think we probably do need, and I think Reverend Emerson made a good point, we probably need to see and make sure who's doing that cutting out down here that may not be getting to this level, because it only gets to the 5 of you if the entire process is clean all the way through. I've heard the word accountability, I've heard the word transparency, I've heard all that. We need to make sure the entire process has all that in it. We will commit to you, we'll do that.
One thing we
I
could
think
do.
I know in the 13 years I've been on this court, I don't think any projects come before us for consideration that diversity was not one of the most important factors and was always considered in the decision of this court.
That is true.
I can not think
Except
of
that
any.
those things were coming directly to us and not being weeded
I
out
understand.
before they got to us.
Well, they were to.
We know who the players are.
And they were being weeded out to some extent because our facilities folks, or our planning folks, were doing the same thing that their employees and their staff were doing. And it came to us, and those staff folks knew how important it was, just as I'm sure your staff people know how important it is, that diversity be a key ingredient in looking at whatever recommendations they made to the board or to the court.
Correct.
I'm comfortable that we have leverage over our staff people. I'm not comfortable that we have leverage over JPS's staff.
I think there may be a way to resolve that by what we've already said, and that is, we are going to publish clearly a report that shows when those interviews are going to take place. So if this, let's say the JPS staff filters it down to 6 or 7 professional service offering, those are gonna come normally. This is, you tell me you don't like this, but normally that would have come as a single recommendation from the staff that would have gone to the committee and then passed on or not to finance. What we could do is we could actually have a section where that smaller number is a meeting that you all are aware of, and actually interview those top ourselves at that level, and not just rely on the staff, but actually create an interview at the planning level. And that way, if there needs to be involvement from the commissioners, if you'd like to attend that, provide input that, then I think there's one more layer of protection if we can do that. And I think that's an easy thing to integrate.
I think that's
Trent,
acceptable.
if I could add to that, Trent, yeah, because I heard earlier that any and all documentation,
Right.
relative to any vendor and/or someone involved in any of this process relative to this bond package, all that documentation will most likely be on a website, well, we can legally use it, but all of it will be out there. You'll know when, who has done it, what the process is, and I agree with you. I think we're going to advise y'all when all those meetings are. Again, I go back to the word transparency. That is the intent, to make sure it's done that way. We'd rather inundate you with too much information than you come back to us and tell us, y'all didn't tell us something.
Yeah, and I might add that, in Trent's suggestion, that one of the processes we have is, before it ever gets to us, the planning committee, there's a score sheet that protects us, and they must address that score sheet. And I think that once that score sheet is done for that 5 or 6 or 2 or 3, you could see that score sheet as well as the contractor interview that contract. Because we would do that. We look at the score sheet and the contractor. So we just don't look, they can do the job or past experiences. We make sure that they got a 20 points here or 50 points here on that score sheet before it goes to approval to finance.
And I'll also make mention, although that I don't sit on planning committee, any one of the board members is welcome to attend any committee member and have a vote within that particular committee.
And they have.
And they have, most do.
Yeah.
We have a very
As long
active
as
board.
everybody's got a say, I'm fine.
I understand.
Agree.
It's important.
So, Your Honor, those individuals who need their parking ticket validated, please see us after the meeting.
Okay.
And that would be now,
Yes. It's amazing how we get to that.
because the Commissioners Court is adjourned.
And the Board of Managers, before I dismiss the Board of Managers, I'll just say, we don't want to forget the 6,700 employees out there at JPS. We appreciate what they do also, so thank y'all. We're adjourned. You know, we're getting so caught up on the bricks and sticks, we forget about, we got all those employees right now.